Chapter 4, Safety and Infection Control. Chapter Objectives. Upon completion of Chapter 4, the learner should be able to do the following. 1. Explain the safety policies and procedures that must be followed in specimen collection and transportation. 2. Define the term healthcare associated or nosocomial infection. 3. Identify the basics of safety, infection control, and isolation procedures. 4. Explain the proper techniques for hand washing, gowning, gloving, masking, double bagging, and entering and exiting the various isolation areas. 5. Identify steps to avoid transmission of bloodborne pathogens, or BBP, and reduce risk for BBP accidental needle sticks. 6. Explain the measures that should be taken for fire, electrical, radiation, and chemical safety in a healthcare facility. 7. Describe the essential elements of a disaster emergency plan for a healthcare facility. 8. List 3 precautions that can reduce the risk of injury to patients. The goal of safety for healthcare facilities is to get rid of hazards for patients and employees and provide safety education for healthcare workers. Safe working guidelines for healthcare facilities and employees have been developed by Federal Occupational Safety and Health Administration, or OSHA, and the Centers for Disease Control and Prevention, or the CDC. Providing protection from hazardous events in healthcare environments for the patient is an important part of the healthcare worker's everyday responsibilities. Personal safety from infection during specimen handling. Patient specimens should be handled with caution to prevent the possibility of acquiring blood-borne pathogens, or BBP, which are infectious organisms found in the blood and other body fluids, such as hepatitis A, B, C, D, and E, viruses, and human immunodeficiency virus, or HIV, syphilis, malaria. See Table 4.1. This preventive approach is called universal precautions. OSHA requires healthcare facilities to protect workers exposed to biological hazards. Healthcare workers who are routinely exposed to blood and bloody body fluids must wear gloves and other personal protective equipment, or PPE, facial shields, gowns, etc., to protect themselves from infection as well. These requirements have occurred because of the 1991 OSHA standards for occupational exposure to bloodborne pathogens, 29 CFR 1930.1030, and the Needle Stick Safety and Prevention Act 2001. These federal regulations require that in most cases warning labels be placed on containers such as refrigerators, freezers, infectious waste, etc., that contain blood or other potentially infectious materials. The labels required are fluorescent orange or orange red and feature the biohazard alerts as shown in Figure 4.1 and Figure 4.2. Table 4.1, blood-borne pathogens. Examples of body fluids that can potentially carry the HIV and hepatitis B virus and other BBPs: blood, saliva involved in dental procedures, cerebrospinal fluid, cell cultures, human tissue, semen and vaginal secretions, all body fluids containing blood. Transmission routes, exposure to broken skin. Risk increase if contact involves a large area of skin or BBP contact is prolonged. Increased BBP levels leads to increased risk. Misuse of sharps such as eyes, nose, and or mouth splashed by infected body fluid. Engineering controls, leak-proof containers, sharps containers, needleless devices such as retractable syringes, self-sheathing needles, personal protective equipment such as gloves, lab coats, scrub suits, gowns, goggles, and safety glasses. Exposure control. If an accident such as a needle stick occurs, the injured healthcare worker should immediately cleanse the area with isopropyl alcohol and apply an adhesive bandage. Any incident of exposure to potentially harmful blood-borne pathogens or other infectious body fluids should be reported immediately to the supervisor. Each healthcare worker should know who to contact, where to go, and what to do if exposed to harmful pathogens. The report must include the blood collection device that did not work effectively to protect the healthcare worker during blood collection. If exposures are not reported, it is difficult to prove retrospectively that an exposure to an infection was caused by working conditions. Healthcare-associated or nosocomial infections. Healthcare-associated nosocomial infections are those that are acquired by a patient after admission to a healthcare facility, such as a hospital, clinic, or nursing home. In an attempt to control them, infection control programs have been developed using guidelines established by the CDC, the Joint Commission, and state regulatory agencies. Managers of healthcare institutions address the issues of proper aseptic techniques, such as maintaining conditions to prevent growth of microorganisms, isolation procedures, education, and management of healthcare-associated infections. The cornerstone of infection protection for patients and healthcare workers are aseptic techniques, which include the following: frequent hand washing or hand hygiene, use of barrier garments and personal protective equipment, PPE, waste management of contaminated materials, use of proper cleaning solutions, following standard precaution, using sterile procedures when necessary. Clinical alert. OSHA requires managers at healthcare facilities to provide a confidential medical evaluation, treatment, and follow-up for any employee who has a bloodborne exposure incident, such as needle sticks. Immediately after an exposure incident, the employee must decontaminate the needle stick site or other sharps injury, such as shards of glass, with soap and water or an appropriate antiseptic, such as iodine, for 30 seconds. Flush the exposed mucous membrane site, such as eyes, nose, or mouth, with water or sterile saline for 10 to 15 minutes. Use an eye wash station if available to flush the site. Contact lenses must be removed immediately and disinfected before reuse or discarded. Report the incident to his or her supervisor, who will direct the employee to the appropriate clinic for medical evaluation, treatment, and counseling. The medical evaluation involves the following steps. The exposed healthcare worker, HCW, is identified in a confidential manner and tested for HIV, hepatitis B virus, and hepatitis C virus with permission from the healthcare worker. Hopefully, the HCW has previously received the HPV vaccine as required for working in a healthcare environment. The exposed HCW should receive counseling, medical evaluation, possible antiviral treatment, and post-exposure testing immediately. The scheduled protocol for follow-up treatment, testing, and counseling is dependent upon the severity of the exposure. The exposed HCW is counseled to be alert for acute viral symptoms within 12 weeks of exposure. This entire medical evaluation must be completely confidential. These protective procedures must be part of the healthcare worker's routine procedures and standards for practice because each healthcare facility has its own infection control program and policy manual. The healthcare workers should read and be familiar with both. Chain of infection. Nosocomial or healthcare-associated infections result when the chain of infection is complete, as seen in Table 4.2. Table 4.2, chain of infection. A pathogen must be present. A source of disease, including patients who have a disease and human carriers of disease, such as healthcare providers and patients' family members who are unaware they have the disease but can still transmit it to another. A mode of transmission for the pathogen to pass directly from the source to the new host, such as touching infected individuals spreading infection through coughing or sneezing, inadequate ventilation, and invasive medical instruments. A susceptible host, such as the hospital patient that cannot fight off the pathogen, such as elderly persons and pathogens with cancer. The three components that make up the chain are 1, a source, 2, a mode of transmission, and 3, a susceptible host. Infection control programs aim at breaking the infection chain at one or more links, as shown in Figure 4.3. And Figure 4.3 shows the chain of infection. Hand hygiene procedures for sterile technique, proper waste disposal, appropriate laundry services, and housekeeping are ways of controlling the sources. Isolation techniques, control of insects and rodents, and the use of disposable equipment and supplies help interrupt the mode of transmission. Host susceptibility is controlled by speeding the patient's recovery. Immunizations, transfusions, proper nutrition, medication, and adequate exercise all help the patient to become healthy. Standard precautions. Standard precautions, as shown in Figure 4.4, have been designed through the CDC to decrease the risk of transmission of microorganisms from both recognized and unrecognized sources of infection in hospitals. Standard precautions include universal precautions that are designed to prevent transmission of all infectious agents in the healthcare setting. They provide protection from contact with blood, all blood fluids, all body fluids, mucous membranes, and non-intact skin. Transmission-based precautions are used in addition to standard precautions for patients with known or suspected infections that are spread in one of three ways: by 1, airborne transmission, 2, droplet transmission, or 3, contact transmission. Airborne precautions decrease the spread of airborne droplet transmission of infectious disease such as rubella, varicella, and tuberculosis. Droplet precautions are used to decrease the transmissions of diseases such as pertussis or whooping cough and pneumonia. These diseases can be transmitted through contact with eye, mouth, or nose secretions from sneezing, coughing, or talking. Contact precautions decrease the risk of infection to other patients and healthcare workers from diseases such as herpes simplex that can occur through direct or indirect contact. Standard precautions for infection control. Figure 4.4. Hand hygiene. Wash after touching body fluids, after removing gloves, and between patient contacts. If hands are not visibly soiled, use an alcohol-based hand rub for routinely decontaminating hands. Gloves. Wear gloves before touching body fluids, mucous membranes, and non-intact skin. Mask and eye protection or face shields. Protect the eyes, nose, mouth during procedures that cause splashes or sprays of body fluids. Gown. Wear a gown during procedures that may cause splashes or sprays of body fluids. Patient care equipment. Handle soiled equipment so as to prevent personal contamination and transfer to other patients. Environmental control. Follow hospital procedures for cleaning beds, equipment, and frequently touched surfaces. Linen. Handle linen soiled with body fluids so as to prevent personal contamination and transfer to other patients. Occupational health and blood-borne pathogens. Prevent injuries from needles, scalpels, and other sharp devices. Never recap needles using both hands. Place sharps in puncture-proof sharps containers. Use resuscitation devices as an alternative to mouth-to-mouth resuscitation. Patient placement. Use a private room for a patient who contaminates the environment. Body fluids include blood, secretions, and excretions. All three types of precautions may be used at one time when multiple infectious microorganisms are suspected in a patient. These precautions are always used with standard precautions. Table 4.3 provides detailed recommendations by the Department of Health and Human Services, CDC, for using these isolation precautions. Contact. The purpose of contact precautions are to prevent transmission of known or suspected infected or colonized microorganisms by direct or indirect or hand or skin-to-skin contact that occurs when providing direct or indirect patient care. Conditions for which contact precautions are required are diphtheria, herpes simplex, scabies, staphylococcus infection, hepatitis A, and respiratory syncytial virus wound or skin infection. The patient should be placed in a private room. Placement can be placed in a room of patient with the same, but can be placed in a room with a patient of the same microorganism. A mask is not necessary. Wear gloves when entering the room. Change gloves after contact with infected materials such as wound drainage or fecal material, and wash hands immediately after removing gloves. Droplet precautions. Droplet precautions prevent transmission of large particle droplets larger than 5 microns, such as found in diphtheria, pertussis, streptococcal pharyngitis, or strep throat, pneumonia, scarlet fever, meningitis, or rubella. Patients should be in a private room, but can be placed in a room of patients with the same diagnosis. You should use a mask when working within 3 feet of the patient and follow standard precautions. Airborne precautions. Airborne precautions used to prevent transmission of small particle residue of 5 microns or smaller droplets, such as measles, varicella, and tuberculosis. Patients should be in a private room, but can be placed in a room of a patient with the same diagnosis. You should monitor the negative air pressure, keep the door closed, and keep the patient in the room. Respiratory protective equipment is necessary. Do not enter the room of patients with rubella or varicella if susceptible to these infections. Follow healthcare institutions' policy for possible cases of multi-drug resistant TB, SARS, influenza, and other highly contagious respiratory diseases, and follow standard precautions. Contact precautions. In patients with contact, use gloves when working with patients with diarrhea, ostomies, or wound drainage, not contained in dressing. Wear gown if contact with patient or environment will occur. In contact precautions for patient transport, transfer only if essential. Ensure precautions are maintained to minimize risk of transmission. And patient care items. Patient care items and environmental surfaces are cleaned daily. Dedicated equipment to single patient use. Stethoscope, thermometer, and these are for patients with contact precautions. In patients with droplet precautions, transport only if necessary. Place mask on patient when outside the room. On patient with airborne precautions, transport only if essential. Place mask on patient when outside the room. Clinical alert. Respiratory, hygiene, and cough etiquette. The CDC has designed measures to minimize the transmission of respiratory disease via droplet or airborne routes in healthcare settings. The keys of respiratory hygiene, cough etiquette are covering the mouth and nose during coughing and sneezing, using tissues to avoid spreading respiratory secretions to others with immediate disposal into a no-touch receptacle, offering a mask to persons who are coughing to decrease contamination of the surrounding environment, and turning the head away from others and maintaining separation, ideally greater than 3 feet when coughing. These measures should be followed by all individuals with symptoms of respiratory infection. Use of standard precaution. Healthcare workers should follow these guidelines when collecting blood from a patient in order to reduce the possibility of becoming infected by a patient. Use personal protective equipment or PPE, such as gloves, facial masks, shields, gowns, respirators, to prevent skin and mucous membrane exposure when contact with blood or other body fluids of any patient is anticipated. This will prevent transmission by fomites or objects that transmit infections such as doorknobs, telephones, countertops, etc. Gloves should be worn for handling objects or surfaces soiled with blood or bloody fluids, and for performing venipunctures, skin punctures, and IV line collections. Gloves should be changed after contact with each patient, and wash the hands or use alcohol sanitizers after glove removal and before donning new gloves. Mask and protective eyewear or face shields should be worn to prevent exposure of mucous membranes of the mouth, nose, and eyes during procedures that are likely to cause droplets or splashes of blood or other body fluids. A personal respirator should be used if the risk of tuberculosis is present. Footwear, i.e. covers for the entire foot, should be worn. These protect against broken glass, possibly contaminated with blood or other body fluids. Flip-flops, sandals, and clogs are not recommended. Hand hygiene includes both hand washing with either plain or antiseptic containing soap and water, and use of alcohol-based products such as gels and foams. Figure 4.5 that do not require the use of water. Hands and other skin surfaces should be washed immediately and thoroughly if contaminated with blood or other body fluids. Hands should be washed immediately after gloves are removed. Proper hand washing technique is shown in Procedure 4.1. Although alcohol-based hand antiseptics are not appropriate for use when hands are visibly dirty or contaminated, alcohols are more effective than plain or antimicrobial soap for standard hand washing or hand antiseptics by healthcare providers. It is important to always wash your hands after contact with blood, body fluids, or contaminated objects, whether or not gloves are worn. Placing gloves on dirty hands can transfer microorganisms after the gloves are taken off. Proper donning and removing of gloves is shown in Procedure 4.2. Clinical alert. Do not wear artificial fingernails or extenders because of the possible spread of pathogenic infections and fungus to patients. Removing gloves after collecting blood for a patient. Do not wear the same pair of gloves for the blood collection of more than one patient. Wash or decontaminate hands with an alcohol-based rub before placing new gloves on hands. Take precautions to prevent injuries caused by needles and other sharp instruments or devices during blood collection procedures, during the disposal of used needles or lancets, when handling any sharp instrument after procedures. To prevent infections from BBPs as a result of needle stick injuries, healthcare workers should only use safety engineered needle and sharp devices. Never recap needles, purposely bend or break them by hand, remove them from disposable syringes or holders, or handle them for any reason. Immediately dispose of blood tube holder and safety needle as a single unit after blood collection. Place disposable syringes and needles, lancets, and other sharp items after they are used in puncture-resistant containers for transport to the biohazardous waste center. Procedure 4.1 shows hand washing technique. Rationale: to perform proper hand washing technique. Clinical alert: standard precautions have been designed to be used for patients, healthcare providers, and visitors in healthcare facilities. Standard precautions reduce the risk of infections being transmitted from healthcare workers to patients, patients to patients, patients to healthcare workers, and healthcare workers to other healthcare workers or visitors. These precautions apply in the following situations: contact with blood, contact with body fluids, contact with mucous membranes and wounds. Isolation for hospital outbreaks. Occasionally, outbreaks of a particular infection occur in one or more hospital areas. To control the outbreak, the need for special precautions and isolation precautions might occur. Any healthcare worker entering or exiting these areas should be made aware of the special circumstances. Procedure 4.2 shows the donning and removing of gloves. Protective environment or reverse isolation. Some hospitals in the United States have protective environment facilities for patients who have suppression of their immune systems due to stem cell transplantation, or other disorders such as cancer. They must live in an environment that is completely sterile. All food and articles are sterilized before they are taken into the patient's room. Some patients must live in these protected environments when they are recovering from, for example, cancer treatments. Infection control in special hospital units. Infection control in a nursery unit. Newborns are easy targets for infections of all sorts because their immune systems are not fully developed at birth. Neonates may pick up pathogens from their mothers, other babies, or hospital personnel. The best way to minimize infection is to use gloves and an antiseptic for hand washing. Special clothing may be worn by nursery personnel, changed daily and limited to the unit. Bibs should be used and discarded after contact with only one baby. Often a baby is assigned a single nurse to limit the possible sources of infection transmission. A major concern in neonatal ICUs and nursery units is the transfer of the highly contagious methicillin-resistant Staphylococcus aureus, or MRSA, and other antibiotic-resistant microorganisms. Many healthcare institutions have an anteroom or outer room where the healthcare worker can perform the infection control procedures of hand hygiene, gowning, gloving, and so on prior to entering the nursery or neonatal ICU. Infection control in a burn unit. Patients with burns are also highly susceptible to infection. Each bed is surrounded by a plastic curtain with sleeves. Hospital personnel use their sleeves to have contact with the patient. All supplies and equipment are kept outside the curtain. In hospitals lacking these facilities, burn patients are housed in private rooms. Gowning, gloving, double bagging, described in Procedure 4.5, disposing of contaminated items on page 100, and strict hand washing procedures should be used. All articles in the room, as well as the room itself, should be disinfected or sterilized frequently. Infection control in an ICU or post-operative care unit. Patients in intensive care units or ICUs are more critically ill and by nature are more susceptible to infections. In most hospitals, ICUs are open areas with numerous patients in one large room. Patients with known infections are isolated according to the types of infections they have, and strict hand washing and gloving policies are necessary in all ICUs. Specific isolation techniques and procedural steps. In most hospitals, all supplies required for isolation procedures, see Procedure 4.3, 4.4, 4.5, and 4.6 are located in an area or on a cart just outside the patient's room. See Figure 418. These include disposable gloves, gown, mask, protective eyewear. The type of PPE used will vary based on the level of precautions required, such as standard, contact, droplet, or airborne infection isolation. Isolation item disposal. The supplies needed for isolation item disposal includes a garbage bag, a linen hamper, large red isolation bag, specimen container, plastic bag with biohazard label, laundry bag, puncture-resistant disposable container for needles and sharps, gloves, antiseptic agent or antimicrobial agent. Isolation bags for transporting specimens should be turned halfway inside out and left near the door outside the room. Someone may be available to hold the bag outside the door. Only the needed supplies should be taken into the room. Phlebotomy requisitions may be left outside of the room on the isolation cart. If collecting a blood specimen, the healthcare provider may use a tourniquet in the room or leave the one brought in. The specimen should be labeled at the bedside and the pen left in the room. Use needles, swabs, and so forth. Used needles, swabs, and so forth should be put in appropriate containers inside the room. Any blood on the outside of the specimen container should be removed with a paper towel while standing in the doorway and touching only the inside of the isolation bag. The healthcare worker should place the specimen inside the bag. Gloved hands should be washed in the room. The faucet may be turned off with a paper towel. Pages. End of page 95, pages 96, 97, 98, 99, 100, and part of HUT 101 shows procedures 4.3, which is gown and masking and gloving, 4.4, which is removal of isolation gown, mask, and gloves, and 4.5, disposal of contaminated items, and 4.6, removal of patient specimen for isolation room. Infection control and safety in the clinical laboratory. The laboratory receives numerous specimens for diagnostic procedures to be performed to determine causes of disease and disorders. Healthcare providers or healthcare workers in the laboratory must be extremely cautious because they often handle specimens with infectious agents. The following essentials of standard precautions and safe laboratory work practices should be adhered to when in the laboratory. Perform frequent hand hygiene. Assume all patients are infectious for HIV and other bloodborne pathogens. Use personal protection equipment. Use appropriate waste disposal practices. Maintain good personal hygiene, including wearing clean clothes, keeping hair clean and tied back if necessary, keeping fingernails clean, and washing hands frequently. Avoid wearing laboratory coat or other PPE outside of the designated area for use, such as not laboratory coats in the lunchroom or at home. Do not eat, drink, smoke, or apply cosmetics, including lip balm. Avoid storing food and drinks in the laboratory refrigerator or freezer used for refrigerate reagents and specimens. Do not insert or remove contact lenses. Avoid biting nails or chewing on pens. Carefully dispose of safety needles, lancets, and other blood collection supplies in appropriate biohazardous labeled containers. Maintain good health by eating balanced meals, getting enough sleep, and getting through enough exercise. Report personal illness to supervisors. Become familiar with and observe all isolation policies. Learn about the job-related aspects of infection control and share this information with others. Caution all personnel working with known hazardous materials. This can be done with proper warning labels. Report violations of the policies. Cover patient specimens at all times during transportation and centrifugation. Centrifuge specimens within a biohazard safety hood. Clean phlebotomy trays at least once a week with 1 to 10 bleach solution. Clean the specimen collection area with decontaminated 1 to 10 bleach solution. Disinfectants and antiseptics. Disinfectants are chemical compounds used to remove or kill pathogenic microorganisms. Chemical disinfectants are regulated by the Environmental Protection Agency, or the EPA. Antiseptics are chemicals used to inhibit the growth and development of microorganisms, but they do not necessarily kill them. Antiseptics may be used on human skin, whereas disinfectants are generally used on surfaces and instruments because they are too corrosive for direct use on skin. A disinfectant with a product label claiming that the disinfectant is HIV-cidal or tuberculocidal, or a disinfectant having a chlorine bleach dilution of 110 should be used to disinfect items contaminated with blood or other body fluids. A more dilute solution of chlorine bleach 1-100 can be used for routine cleaning of surfaces. Gloves and gowns should be worn when performing decontamination procedures. The minimal contact time for disinfectants to be effective is 10 minutes. Table 4.4 lists some of the more common hospital disinfectants and antiseptics. Fire safety. Fire safety is the responsibility of all employees in a healthcare institution. Fire or explosive hazards may occur in a laboratory or other areas of healthcare facility. Healthcare workers should be familiar with not only the use and location of the fire extinguishers, but also the procedures to follow during a fire. They should also be knowledgeable of the exact locations of fire extinguishers and fire blankets. The blankets should be available to smother burning clothes or to use a fire shield if fire is blocking the exit. Healthcare institutions usually conduct periodic safety education programs in which the healthcare worker can participate to become skillful in and knowledgeable about the use of fire safety equipment, as shown in Figure 433. Healthcare workers need to learn how to use fire extinguishers, as shown in Figure 434. Class A fires requires an ABC extinguisher or pressurized water extinguisher for wood, paper, clothing, and trash. The Class B fires need an ABC extinguisher or a carbon dioxide extinguisher for liquids, grease, and chemical fires. Class C fires are electrical fires, and a CO2, halon, or ABC extinguisher can be used. The ABC extinguisher is found in most healthcare facilities, so healthcare workers need not worry about which extinguishers to use in case of a fire. Figure 434 shows proper use of the fire extinguishers. Emergency response to possible fire. If a fire or explosion occurs in the workplace, the healthcare worker should not do the following. Do not block entrances. Do not re-enter the building. Do not panic. Do not run. Instead, the healthcare worker should race, rescue, alarm, contain, exit. Race by doing the following. Pull the nearest fire alarm. Call 911 or the hospital's fire emergency number, which should be posted on or near the phone. Remove patients from danger if on a patient floor. Close windows and doors to prevent spreading of the fire. If the fire is small and isolated from other possible fuel sources, use an ABC extinguisher to fight it. Pull the plastic pin off of the extinguisher, as shown in Figure 435. Aim the extinguisher at the base of the fire and squeeze the handle. Spray the solution toward the base of the fire, but do not point it directly at an individual. If the fire threatens to block exits or is not small, leave the area immediately. Take the stairs, not the elevator. If clothing is on fire, drop to the ground and roll, preferably in a fire blanket. If caught in a fire, crawl to the exit because smoke rises. Breathing is easier at a floor level. Breathing through a wet towel is also helpful. Electrical safety. A major hazard in any area of healthcare institution is the possibility of electrical current passing through a person. The important safety points to remember are: do not use power cords that are frayed. Avoid using extension cords. Unplug electrical equipment before preventative maintenance or any repairs. While collecting blood, avoid contact with any electrical equipment because the electricity may pass through you and the needle and shock the patient. Use 3-prong electrical plugs for all equipment, as shown in Figure 436. Radiation safety. The 3 cardinal principles of self-protection from radiation exposure are time, shielding, and distance. Radiation exposure is cumulative, thus limiting the length of the exposure at any one time is a major factor in minimizing the hazard. Areas where radioactive materials are in use and stored must have warning signs. See Figure 437, posted on the entrance doors. The healthcare worker will probably encounter potential hazards from radiation exposure only if he or she must collect specimens from patients in the nuclear medicine or X-ray department, or must take specimens to the radioimmunoassay section of a research or clinical chemistry laboratory. Thus, the healthcare worker should be cautious when entering an area posted with radiation hazard sign and should be knowledgeable about the institution's procedures pertaining to radiation safety. If the healthcare worker must collect specimens in areas where high levels of radioactivity may occur, i.e., nuclear medicine imaging center, he or she must wear a dosimeter badge to determine the amount. Check for food or liquid spilled on the floor, urine spills, or IV line leakage. If the patient alarm for IV drip is sound, then report this problem to the nursing station immediately. If the patient is in unusual pain or unresponsive, notify the nursing station immediately. Patient safety related to latex products. Patients as well as healthcare providers or workers may be allergic to latex products. Figures 442. The signs and symptoms of allergic reaction to latex may include skin rash, hives, nasal, eye, or sinus irritation, and sometimes shock. Table 4.5 provides examples of items frequently used in the healthcare environment that contain latex. Figure 443 shows an example of a latex-safe environment sign. Disaster emergency plan. Many healthcare institutions have developed procedures to be followed in case of a hurricane, flood, earthquake, bomb threat, and other disasters. The healthcare worker should become familiar with these procedures because he or she must be prepared to take immediate action whenever conditions warrant such action. Clinical alert. If someone telephones and threatens to bomb the healthcare facility, listen to the person and keep him or her talking. Listen for background noises to identify the caller's location. Listen for the caller's accent, language, and voice characteristics. Ask the caller where the bomb is located and what time it will go off. Write down everything the caller states. Notify the healthcare facility security officer. If a bomb threat procedure is in place, it must be used by all healthcare workers.